One of the most common reasons patients come to see me for treatment is because they think they have ADHD. This is worth mentioning because probably 8 times out of 10, the patient doesn't actually have ADHD. What they have is untreated or undertreated anxiety. So the question becomes, how do we suss this out? So the only way to know that someone has ADHD for sure is through neuropsychiatric testing. And that's roughly a half day of tests to assess focus and concentration. In the absence of that, you can have the patient complete screeners and then compare it to the diagnostic criteria for ADHD. And you get a good developmental history, a neurodevelopmental history, showing that the patient has always had issues and that they're present in more than one setting. So work, school, home, just more than one. And sometimes it's really quite clear that someone does have ADHD. However, the more common scenario that I see is that someone will come to me and they'll tell me that for the last few years, they've had issues with focus and concentration and getting easily distracted. And they'll say, I go from one task to the next without finishing, or I just can't seem to get started on anything. Okay, why is that? We don't actually ask a lot of why questions in psychiatry because patients often don't know the why. They don't know the answer to that. What I will ask is, well, are you just feeling so overwhelmed that you don't know where to begin? Or is it difficult to start because the job just seems so overwhelming? So what usually happens is that it'll come out that the person is completely overtasked and overwhelmed in their day-to-day life. And I'll ask about baseline level of anxiety, and they'll tell me, 7 or 8 out of 10. So yes, of course you're having a hard time focusing and concentrating when you're that physically activated all the time, or you have a constant internal narrative running in your head of all the things you have to do. Other evidence that it's actually anxiety and not ADHD is that the person did well when they were in school without really struggling. And this isn't 100% foolproof because there are those people that don't have to study. And people learn to function within their ADHD and learn how to cope with that. The point is that you get a really good history and timeline. You figure out the why behind the patient's symptoms, and then you put all of that together to get the clearest clinical picture of what's actually going on with the patient.